And Lauren, I have a million questions, and they range from, how worried are you about these new variants and, the fact that vaccines could not be efficacious in combating them, or the simple logistics of vaccinating people right now. What worries you most?
I think what worries me most is that we're seeing these surging cases, and this new variant does have such a higher transmissibility, it's looking like. So as we're rolling out these vaccination campaigns, which is the good news, the bad news is that a 50% increase in transmissibility, which some of the projections have shown in this new variant, means more hospitalizations, more cases everywhere. Luckily, that variant is not showing worse outcomes yet or more severe disease yet, but just the sheer numbers that we already have right now, and that variant isn't everywhere, but we're seeing it more and more as we're doing more and more testing. It's bound to increase the number of cases, and coming on the end of the holiday season where people have traveled a lot more than I think a lot of us were expecting or hoping to see. I think we're going to see a pretty significant surge going into the new year.
Lauren, is there a danger that if you start vaccinating people just when there are a number of infected cases on the rise, that because of that, doing that at the same time, you actually end up with another variant?
I think there's always a possibility of another variant. Viruses, as they replicate, they make changes in their copies, and variants happen all the time. I think there is some worry about a potential for another variant like this one, where we see either increased severity or increased transmission. That being said, a lot of work is going in right now into assessing whether the variant impacts the ability or the coverage of the vaccine. And so right now we're hopeful that at least with this variant and hopefully with others, that these vaccines that we've worked painstakingly to create and to begin to administer will maintain stability.
Do you, again, did we underestimate the challenges of, a vaccine rollout at this scale?
I think there were some areas where we underestimated the challenges. I think one of those areas in particular is staffing of these vaccine rollouts. I have been very impressed by the management of the cold chain storage issues. I think that's an area that everyone was worried about in the rollout. But staffing, people continue to be a huge challenge. And then and how you roll out these vaccination campaigns where it's not just a jab in the arm and you're on your way. There's other elements. There's the sign up, there's the pre-screening, there's the intake. Giving the vaccine doesn't take that long, but then you have to sit for 15 or so minutes to make sure you don't have an adverse reaction. All that adds up, and all of those elements of the vaccine rollout or of the vaccine process take people to do those pieces. And so ensuring that we have the staffing to roll this out and scale it up en masse is going to be it's going to continue to be an enormous challenge. And I think we're seeing that already in the first phases of rollout, but we will see it significantly. It will have a much more significant impact as we roll out to the general population.
Lauren, I know we're spending a lot of time talking about Georgia, the state in the U.S., of course, today. How much, different are COVID cases going up or down depending on what state in the U.S. you're looking at?
I think COVID cases are ticking up in many places, and that's concerning. We've had surges all across the U.S. Georgia is surging, and they are one of the states that has reported this new variant. So I think there's a lot of eyes on Georgia to see what their cases do over the next couple of weeks. They don't have many restrictions in Georgia compared to other states in the U.S. So I think there's a lot of worry that we'll see increased caseloads there as that variant spreads and as people traveled for the holidays with minimal restrictions and requirements.
Very quickly, Lauren, are people willing to get vaccinated in the U.S.?
I think there's a lot of people who are willing. I think there's a lot of work that we have to do in that space to make sure that more and more people come over to the side of the willing to know that this vaccine is safe, effective, and available, particularly to healthcare workers, and as availability scales up significantly, hopefully to everyone.